Hi, my name is Kara Magneheim. I'm a Veterinary Technician Specialist in Emergency and Critical Care. I work at BluePearl Pet Hospital. When your pet initially has a feeding tube placed, your veterinarian is going to come up with a specific nutritional plan to ensure that the needs of your pet are being fulfilled. Make sure that you're consulting with that plan while you're using your feeding tube. In order to feed your pet through the tube, you want to make sure that the food is not too hot and not too cold. And for that is your cold food is going to shock the stomach. It can make your pet very nauseous. And your warm food, we want to make sure that it's not so hot that it's causing burns. So what I like to do in order to make the diets the way that we would like them is I will heat it up similar to a baby bottle, where I put a bowl of water in the microwave or on the stove and heat it up, and then set my container of food, whatever I'm going to use for that feeding, in the bowl and kind of warm it up for that feeding. Before you even get your pet, it's best to get everything prepared. So what we have here is everything that you're going to need to feed your pet through the tube. Your pet has an esophageal tube or a gastric tube. What I usually do is take my canned food and I put it in the blender and just make a fine baby food type consistency out of it, because we want it to not clog up the tube. We don't want any big chunks going through. Paper towels, because this can get a little bit messy. The same with the towel. If you can use paper towels or regular towels, and the towel's going to help keep your pet nice and comfortable too. Syringes of various sizes. I usually just kind of pick the one that's appropriate for the pet and how much food I'm trying to give. I like these catheter tipped syringes because they usually go on the ends of my tube nice and easy. If your pet has been prescribed that by your veterinarian, you have a liquid diet option. And then your glass of warmed water if you need it. If you're taking your food out of the fridge, remember we just wanted that to be a nice good room temperature so it's comfortable for your pet. So depending on what's going on with your pet, there's a variety of different tube options. This one goes in through the nose and it ends in either the esophagus, which is just above the stomach, or it ends all the way in the stomach. It's got a variety of different holes on the top, which you use for putting in food or water, and it just depends on the syringe that you have. I usually go ahead and use this big hole for my big tip syringes, and I put the food in here just nice and slow. You want to not really try and put medications or any large kind of molecules food down here, because it's going to clog really easy. It's such a narrow diameter that you end up with a lot of clogs, and they can be a real pain to fix. And sometimes the tube actually has to be replaced, which is a lot of extra things for you and your pet to have to go through. So just try and make sure that you're flushing with warm water before and after, and just make sure that you're kind of not letting that clog up. Just use the liquid diet is best for these tubes. This is little suture braces basically for the tube. You may or may not see these on your pet's tube. If your pet has these in place, you notice that they're coming up off of the skin, or they're loose, or they're missing, call your veterinarian and see what they want to do about that, because they may need to replace them. They may need to re-secure the tube. You're never really going to see this part of the pet's tube. If you do, if it comes back out, sometimes they come back up the pet's mouth, or they'll cough them up, or they'll sneeze them up. You need to bring your pet back in if you're seeing the end of this tube anywhere. Bring your pet back into the veterinarian and do not use the tube. Our next option for tubes is going to be the esophageal feeding tube. This one goes in through the side of the pet's neck, right into the esophagus, and it ends right before the stomach. This one is a much larger diameter, so it's much easier for long-term use for your pet and for maintaining at home. It's got the same kind of idea up top, where it's got different sized holes depending on which type of syringe that you have and what you're trying to put in through the tube. I generally prefer to use this big hole because it's the easiest to keep clear and to keep food going down in a good way. You're just going to open that up. You're going to flush with warm water, same before and after, as you would do with the other tubes. Just warm water before and after you feed. And then you've got this nice big diameter. So you can use like a blenderized diet, something baby food consistency. You can also use this tube for medications. It's also got these little suture wings here. So these are going to be what's holding the tube in place for your pet. And then your pet may or may not go home with kind of this collar in place. And this side of the collar is going to rest right up against the insertion point of the tube on your pet's neck. You're going to change this collar periodically and open it every day and look at the insertion site and make sure that it's not swollen, there's no discharge, make sure that it appears clean, dry, and the sutures appear intact. You're not seeing any food leaking back up around that site. This collar then secures around your pet's neck And there's a little tab here that holds this tube in place so it's not flapping around, it's not causing an inconvenience for your pet. You're never gonna see this end of the tube. If you do see this end of the tube, it's come back up your pet's mouth or nose, whatever the case may be. You need to call your veterinarian right away and stop using the tube. Don't try and replace it yourself. So now that you've gathered all your supplies, you're ready to feed your pet. The first thing that we're gonna do is just take a regular amount of water, and that's whatever's normal for your pet. So 5 mils for a small cat or dog, or I use 10 to 15 for one of my larger pets, like a Labrador or a Sheltie or something like that. The first thing that you're gonna do is just open up that tube, and you wanna just flush your tube. And what you're doing here is just checking for any resistance. Make sure that it feels good, and you're not feeling like you're pushing really hard on this syringe, and you're just flushing that through. There you go. And once you're flushed, you can just go ahead and close that back up. The next thing that you're gonna do is draw up your food. And this is gonna be the amount that's prescribed by your veterinarian. We're gonna use the liquid diet. You're gonna pull up your syringe. And what you're doing is you're pulling up to the amount that they said. So this black part of the syringe is gonna be the line that you're reading when you're looking to see what the appropriate volume is. In this case, we're gonna pull it up to the 20 mils. And then just flip that bottle back over and unhook it. This is a little cold, so we're gonna put it in the water just to warm it up for a couple of minutes. And you can just put it tip down just like that. It shouldn't leak. It might leak a little bit, it might get a little water in it, but that's fine. Your pet needs water anyway. And honestly, it's all going to the same place. A little extra hydration is not gonna hurt. So you're just gonna leave that in there until it's nice and room temperature, not warm. And I will usually just check it on myself, just like checking a baby's bottle, and make sure that it's a good temperature for your pet. Remember, nothing too hot or too cold, because we don't want to either burn them or cause a little nausea. Once you've done that, you can reopen your tube and just put this right in this big hole. And then push just a little slowly. Remember, you want to make sure that as you're going down the tube, your pet's not getting very full very suddenly, because that's going to be really upsetting to their stomach. So I'm just going to push, and this tube is always cut to the size of your pet, so it may be shorter on the inside of your pet. But I'll just push in nice and slow increments to make sure that everything's going in nice and slow. And my pet's not getting super full. While I'm doing this, I'm keeping an eye on my pet. So if I'm looking for extra drooling or kind of smacking in the lips, kind of like that's all good signs of nausea. You might notice your pet swallowing, and that's totally normal. That's a reflex that they have when something is on their esophagus, that they're just gonna swallow normally, because that's what they need to do to open the stomach and move the food along. And as I'm doing this, I'm just pushing very slowly, keeping an eye on my pet. If my pet seems like they're getting agitated, they're moving around a lot, now might not be the appropriate time to feed. Think about when you eat a meal or when your pet normally eats a meal. They're not running around while they're doing it. So make sure that they're in a nice, comfortable, relaxed position. And then once all of my food is through, you can just unhook your tube again. And you want to flush it again with a little bit of water. It's the same idea, where you're just going to flush through for a small animal, maybe 5 mils, and for a larger animal, a little bit more. That's going to go right down the tube. And what we're doing here is just cleaning out any residual food, making sure that we don't have any clogs, making sure that we don't have anything blocking up our tube. It's important that you're doing this anytime that you're using the tube, even if you're just using the tube for a quick medication. Flush the tube before and after, because you don't want anything to get stuck in there. And then you just close your tube back up. You might notice that there's still a little bit of water, or whatever you fed your pet might still be in the tube. You're going to notice that kind of start to go down as your pet is swallowing and digesting, and the tube will clear out by the next time that you use it. And that's all there is to it. When you're done feeding your pet, it's important to completely close this tube. Make sure that there's no debris around the top. Make sure everything's clean, because if you leave this tube open, you think about it, anything that your pet lays in, dirt, whatever the case may be, is going to go in that tube and down the stomach. It could also potentially clog the tube. After you're done feeding, it's important to keep an eye on your pet for probably an hour or two, depending on, how much interaction you have with your pet, how excited they are, and their level of illness and severity of nausea. So what you're keeping an eye on for is any sort of vomiting, regurgitation, looking like they're having difficulty breathing, coughing, hard swallowing, hypersalivating, drooling, or just generally looking uncomfortable, pacing, panting, not wanting to lay down. So notice any signs of discomfort, especially difficulty breathing, please call your prescribing veterinarian. These can be pretty serious clinical signs that we don't want to ignore, especially with respiratory difficulty. If you're noticing that in the middle of the night or late in the evening, call your local ER.